Hi, it's a nursing professor. I am here today to just to review some other strategies to be successful on your next exam. I know you get ready to enter the final period, so this is a time when it is do or die for some of you all. And so you have to practice questions. I cannot say it enough. It is not enough for you to think that you read all this material and you're able to digest it and you're able to spit it out onto the paper. Because if you haven't noticed already, nursing questions are predominantly about application and not knowledge. And so many of you all might have the knowledge skill set to be able to answer questions. Like if I said, what is a colostomy? You probably could tell me. However, the important part is how you're going to apply that knowledge to the care of your patient. So we've already gone over, we had the video on some strategies that you can use, as well as we've had the video on the nursing process, which is another useful tool that you can use in order to just kind of drill down to get the right answer. So today, what I want to do is I want to go over 4 questions with you, maybe 5. And I'm going to break down these questions. So I will read the question to you. I will give you the answers. I'll pause. I'll let you try to select the answer. Then I will resume by giving you the right answer. But with that, I'm also going to go through the rationale as to why the other answers were incorrect and why the best answer was the correct answer for it. So hopefully this will be helpful to you. One other thing is that the more questions you do, you will start to realize there's a rhythm to nursing questions. And so once you master that, even if you don't have a clue as to what that answer is, you should be able to eliminate those choices that make no sense and be able to at least get to a point where you're 50-50 as to selecting the best answer. So here we go. So this first question is about a person who has a colostomy. So if you haven't learned about the GI system yet, I'm going to have a video on that. But what happens when a person has a colostomy is that they have an outpouching of the large intestines. Could be small intestine, but for the most part, a colostomy is about the large intestine, whereas an ileostomy is about the small intestine. So just a little FYI. So the person has had some sort of disease process, some trauma, something that happened to make it necessary for the disease portion of the ostomy to be surgically removed. And so as a result of that, as opposed to them pooping out of their rectum, they now poop out of their abdomen, such that there is an opening on their abdomen that allows them to put it into a bag. And so with that, you can only imagine there's lots of concerns. So these questions are going to be primarily about the GI system. So question number 1. A nurse is caring for a patient who has a new colostomy. In formulating the plan of care for this person, remember plan of care, nursing process, what would be a priority goal for this patient? Okay, what would be a priority goal for a patient that has a new colostomy? That is what the question is asking you. Your choices are A, adjust emotionally to the colostomy and lifestyle change, possibly. Verbalize the appropriate steps in caring for the colostomy, probably not. Assume self-care in colostomy management, and experience liquid stool with minimal flatus. And we know flatus is gas, okay? So those are your 4 choices. So let me pause and let me give you a second to select the best choice. Okay, you got it? Because most times you only have a minute to get to the right answer. All right, so the correct answer is actually assume self-care in colostomy management. The reason that is so important is that this person will go home and they must manage the self-care. They're not going home with a nurse. Even if they're given home health, the home health nurse is usually only in the home for 2-3 times a week. So with an ostomy, that bag needs to be emptied or changed several times a day. And so either the person needs to know, that's the preferred thing. But sometimes people right away when they go home from the hospital, they still feel like they can't accept it or can't touch it. And so maybe there's a family member who will be willing to do it. But someone needs to understand that that is their responsibility to maintain and care for that ostomy. It would be just like us or people who poop out of their rectum. At some point, somebody got to wipe your butt. Okay, so that is the rationale behind that being the correct answer, is that is acceptance, that person has to take ownership of it and has to manage it. So let me give you some rationales about the other choices that were there. One of the choices were, adjust emotionally to the colostomy and lifestyle change. Is that important? Yeah, it's quite important. However, it's not the best answer. And this question is asking you about the goal. Okay, goal. So that is the key word of this question. So when you ask about, when you're trying to answer a question about the goal and you're given the choices of adjust emotionally to the colostomy and lifestyle change, you want the person to do that, but there's a better choice. The second answer was verbalize appropriate steps in caring for the colostomy. You don't want that person to only verbalize the steps. You want the person to do it, because many times people can tell you what should be done. However, there's a huge adjustment curve that comes with some of our patients to be able to touch it, to be able to feel it, to be able to know that emptying this bag may be a little messy. Your other choices was the correct choice, which was assume self-care in colostomy management, which is what you want. And the last choice was experience liquid stool with minimum flatus. Well, with a colostomy, many times you're not going to have liquid stool. You will have formed stool depending on where the surgical incision was. But you want them to know how to manage it. Of course, that means emptying it. That means that if they have flatus in the bag, that they have to express it to allow that gas to come out. So all of that is true. However, selecting the best answer would be that person's able to touch themselves. They're able to manage that ostomy themselves, and therefore they are self-care. So that is the goal. So hopefully that makes sense. So now let's go on to another question. Okay, so question number 2. This question is going to be about sleeping and rest. Okay, so we're going to look at a person who sleepwalks. So the question says, the primary focus of nursing interventions, which means your actions, for a client who is experiencing somnambulation, which means sleepwalking, would be to blank. And let me give you the choices. So again, the primary focus of the nursing interventions for a client who is sleepwalking would be blank. Okay. Your choices are A, maintain client safety during episodes of sleepwalking, administer and teach about medications to suppress stage 3 of sleep, where that person's in their deep stage of sleep, encourage the client to verbalize feelings regarding sleep patterns. And 4 is to provide a quiet environment for nighttime sleep. So let me give you a few seconds to come up with the answers. All right, so A was to maintain client safety during episodes of somnambulation. That is correct. The reason that is correct, because whenever you're given choices about safety, safety is always a priority. Always, always, always a priority. And think about this scene. You have a person who is sleepwalking. They don't have a clue that that is what they're doing. They're in the stage of sleep for them where their body is able to get up and move. And many times you'll hear that they went to the refrigerator, they got something to eat, they ate food, went back to sleep. But just envision if that person did more, like they got up, they went out, they got in a car, they drove, they came back around, and they could have hit people or injured themselves or something like that. So safety is always important. So that is why that is the answer. The other choices, let's talk about those for a second. Number 2 or B was administer and teach about medications to suppress stage 3 of sleep. No, you don't want to suppress stages of sleep if at all possible. You want to just make sure that that person remains safe. And so that might mean that someone needs to stay up or have some sort of alarm system or something like that when the person gets up and out of bed. C was encourage the client to verbalize feelings regarding sleep pattern. Very similar to question number 1. Although you want the person to be able to verbalize what's best for them, you really need action. And so if the person is unaware that they're sleepwalking, then them verbalizing something is not going to be action to keep them safe. So that's not the proper answer. The last choice was D, provide a quiet environment for nighttime sleep. Has absolutely nothing to do with a person who suffers from sleepwalking. So that is definitely an answer that you would just toss out. So main takeaway from this is that you were given choices that included safety, and so safety was the preferred answer that you should select from. All right, so question number 3. We're going to take a step and talk about the GU system. So in this particular question, we're asking about technique, about you teaching your patient about proper technique in order to get the type of sample that you want. So the question reads, the nurse instructs a patient about providing a clean catch urine. So first of all, you need to know what a clean catch urine is. Which statement indicates the person correctly understands the procedure? Okay, so you think back to your ATI or FA Davis or whatever you used as far as skills, and you think about what you learned as to how to get a clean catch sample. And so you've all experienced this before as well. When you get a clean catch sample, you go, somebody gives you a wipe, they tell you to wipe off, they tell you to pee in the toilet, you get the sample midstream, put a top on it, has a label, put it in a bag, boom, gone. Okay, so the choices with this question is this. A, I will be sure to urinate into the hat you placed into the toilet seat. Okay. Now remember, we're talking about a clean catch urine. I will wipe my genital area from front to back before I collect the specimen midstream. C, I will need to lie still while you put in a catheter to obtain the specimen. And D, I will collect my urine each time I urinate for the next 24 hours. Okay, so let me pause, give you a minute to select the right answer. All right, so let's go through the answers. A was, I will be sure to urinate into a hat, the hat that you place into the toilet seat. Well, think about the clean catch urine. You don't want urine that's been sitting in a hat. That's not a clean catch. Okay, so automatically that answer does not apply. I will wipe my genital area from front to back, which is what we do teach patients. And then I'm going to get the sample midstream. So I'm going to wipe, I'm going to pee a little bit, midstream, get a sample, put my top on it, leave it for you to do the collection. That is the correct answer. And again, many of you all, if not all of you all, have had to do that at some point. And so that is what a clean catch urine is. So you see, this is really a question about knowledge. However, it is more important to know how to apply that knowledge. So you had to know what a clean catch urine is. Let me give you the other two choices just for sake for us to talk about. I will need to lie still while you perform a catheter insertion on me. When you're using a catheter to obtain a specimen, is that clean catch? No. That is you getting a sterile specimen, which means the catheter is going directly into the bladder and you're being able to get that specimen directly from the bladder before there's any contamination. And your last choice was, I will collect my urine each time I urinate for the next 24 hours. That's a 24-hour urine collection. And so, no, that is not a clean catch. And so if you take a look at the question, you should be able to determine that the correct answer was teaching your patient to wipe front to back, then have them pee a little bit, get the urine specimen midstream, put a top on it, label, boom, finish. Okay? All right, so that was question number 3. Let's do 2 more. All right, so question number 4 is about grief. It's about experiencing loss, which is can be very traumatic for people. It's really, really very difficult as a person, the survivor, goes through it. So question reads, how should a nurse respond to a family immediately after the patient dies? Immediately is the key word. Okay, so let me give you your choices. A, ask the family to leave the patient's room so that post-mortem care can be done. Just think about that. That's a choice. 2, or B, is to leave the tubes and IV lines in place until the family has an opportunity to view the body. Okay? Maybe. C, express sympathy to the family by saying, I'm sorry for your loss. And D is to tell the family they will have limited time to be with their loved one. So I'll give you a few minutes. Think about it. All right. So A talks about the family has to leave so post-mortem care can be done. No. Can you imagine if your loved one died and someone told you you had to leave the room? No. Even though we know post-mortem care is essential, especially if a person is going to have a viewing, because there's some things that the body has to have taken care of as quickly as possible. However, that is not the time that you would do it. B is leaving the tubes and IV lines in place until the family has an opportunity to view the body. No, that's not a good idea either. Once the person has been pronounced dead, then those tubes can be removed unless there's some reason that the coroner's office wants something in place. Okay, but they shouldn't still be there. It's traumatic enough to look at a person who has died. Express sympathy to the family by saying, I'm sorry for your loss. That is the correct answer. Empathy goes a long way. Even if you have never lost a loved one, then you have to imagine that that would be quite difficult for the surviving people, because the people who are left behind, of course, are going to miss the person. And usually at that point, then you can catch some family members who might not be so rational, and so their behavior can be unexpected, and so you don't want to do anything to instigate or create the situation of them displacing their anger on you. And so you want to empathize with the family by saying, I'm sorry for your loss. Your last choice is tell the family that they have limited time with their loved one. No, Even though, again, in reality, we know we don't have 4 or 5 hours for you to stay there, because there's something called rigor mortis that will set in with the body. However, you want to give family their space. You might want to call pastoral counseling. You might ask them if there's anything that you can do to help. You might offer them water, definitely chairs. And usually family members won't want to be there for any length of time. Okay, but you want to make that setting as comfortable as possible, as opposed to rushing them out, because they do have to have time to experience their emotion. All right, one more question for you. All right, so this is your final question. This question is about using the nursing process. So it reads, the nurse is caring for a person that has an indwelling urinary catheter. And again, reminder, as we know, catheters sometimes have to be in place, but they should be there for a very limited amount of time. And so this person, it says, the person had the catheter inserted 10 days ago. In reviewing and revising the plan of care, what is the most important nursing diagnosis for this patient? Okay, so you have a patient, they have an indwelling catheter, they've had it there for 10 days, and you need to come up with the most important nursing diagnosis. So your choices are this. A, disturbed body image. B, risk for infection. C, risk for skin integrity. And D, risk for decreased urine output. So let me give you a few minutes to think about that. I feel like I should have some Jeopardy music or something. All right, here we go. First choice was A, disturbed body image. No, that's not a priority nursing diagnosis for you. Even though if a person has to go home with a urinary catheter, and sometimes they do, then that might be at some point, but that's not the priority when giving those 4 choices. The next choice was risk for infection. We know urinary catheters place a person at a high risk for infection. And so therefore they're usually not in place for a long time, and definitely not 10 days. So that is the correct answer. C was risk for impaired skin integrity. No, because actually a catheter will minimize the risk for impaired skin integrity, because we know that urine on the skin, when a person is incontinent, then that can put the person at a greater risk for skin breakdown. So that answer is definitely wrong. And then your last choice was risk for decreased urinary output. Absolutely wrong, because remember, a urinary catheter is inserted directly into the bladder. And so as long as it's in place, then urine is going to be excreted from the bladder. I mean, that's probably that is the most accurate way of measuring urine, because you're constantly getting urine directly from the bladder. So hopefully that helped. I want you to take your questions and break it down just like that. What you'll notice is that we probably took no more than 1 minute a question, which is usually what's given to you on an exam. And if you take your time and you eliminate those choices that make no sense, and then drill down to where you might have 2 choices to pick the best one. That's it for now. It's the Nursing Professor. I wish you well. I will have more videos. Drop me a line, make a comment. Of course, like, share, and tell me what subjects that you're interested in, because if you want detailed information on, say, the GI system, GU system, skin, wounds, I definitely can do that for you. I want your success, as I've said that over and over and over again. But the best way to get success as far as selecting the best answers for questions is practice, practice, practice. Bye for now.